Let's get medical. New recommendations out today for older adults, like me, about taking aspirin to try to prevent heart attacks and strokes. So our 9 Health expert, Dr. Paul Coley, joins us now to discuss. So break down these new recommendations, which seem to be very different from recommendations that were out just 5 years ago.
It's done a 180, Tom. It's been really interesting. But in the cardiology community, it's not all that new to us because the studies actually came out a few years ago. So there's 2 boxes of people. One is people who've had a heart attack or stroke or have known blockages. Those people need an aspirin. If you're one of those people, do not go off your aspirin, talk to your doctor. The other category is people in whom we're trying to prevent their first heart attack or stroke. That's really who these guidelines focus on, the prevention group. Now, if you're in that category and you're over the age of 60, the studies are telling us you may not benefit from an aspirin.
So we often talk about the dose because I always heard the baby aspirin.
That's
Does
right.
this matter?
It totally matters, Kim, because there's 2 doses here in the United States that we mostly use, 81 milligrams, which is the baby, and then 325 milligrams, which is the full adult, I guess, dose. 325 should never really be used except in very rare situations because it increases risk of bleeding without adding more benefit. So 81 milligrams is the dose we're talking about, most cases, for prevention of heart attacks and strokes.
Is that something that you would self-diagnose? That you just feel like I'm going to take it because I don't want to fall into that box?
Not anymore. So
Okay.
It used to be an aspirin a day keeps
Right.
the doctor away, right? I still remember when I was in training, I was writing all kinds of aspirin prescriptions for people and telling them to start it. It helps with your joints, it helps with everything. But now, based on this data, what we're actually saying is that there's a very small therapeutic window, very few people who would actually benefit. So if you're between 40 and 59, and you have a high risk based on your risk factors, you're somebody who might benefit from an aspirin. If you're diabetic, you need to talk to your doctor because you're sort of in a whole different category. But if you're healthy, over 60, and don't have heart disease, it's actually going to increase your chance of dying,
Wow.
of bleeding, all the things that we had been doing for the last many years, starting aspirin.
It's a complete reversal.
Very much so.
So you mentioned diabetic patients. That's a whole different category?
That's different, and the reason for that is because when you're diabetic, your blood sugar is a little higher. It makes your blood vessels a little stickier, so that cholesterol is more likely to get stuck. So those people are considered a sort of a different risk category, and you should really have a discussion with your physician. What the studies have told us in diabetic patients is that it does reduce heart attacks and strokes, but it also increases bleeding by about the same amount, which is why it has to be that personalized discussion.
Quickly, is there anything you need to worry about interacting with aspirin?
So the most common one that I see, Tom, ibuprofen,
Okay.
Advil, Motrin. People just take it not realizing that they're on an aspirin. They're both blood thinners. They work on the same types of cells. They can cause problems when taken
So
together.
that's a no-go.
Definitely.
No-go. All right. Thanks as always, Dr.
Okay,
Coley.
remember this. Big changes.
That's a big change. That's an
Okay.
important one. So hopefully you paid attention.
He's the only one who raised his hand
Take
for
notes.
older. So
Oh,
he needs
we're
to-
all older. No, only here. The rest of that place, the newsroom, they're all kids. They're children. Anyway, okay, including the producer who's going, rap, rap.